Alrighty, hi everyone. My name is Dr. Katie Eilenfeld. I am a pelvic floor physical therapist with the Hope Doctors. And in this presentation today, we're going to go over what a pelvic floor physical therapist does, how we can serve your clients within that postpartum and prenatal period. So I just want to thank you all so much for tuning in and listening. I truly feel that doulas are one of the most supportive people that a woman can have in her pregnancy and postpartum. So I want to thank you so much for serving the community. And we're going to go ahead and get started. So generally what we're going to be talking about today is, who we are, what we do, when to refer, and then how to contact us. So who we are, as I mentioned in the beginning, we are the Hope Doctors. We're a group of pelvic floor physical therapists striving to make pelvic health care the standard of care while incorporating a whole body approach and eliminating shame and guilt around down there issues. So what makes us different from your standard pelvic floor physical therapist is we're not just looking at those pelvic floor muscles. We're going to take a look at the entire body, head to toe, because we know how much the body changes within pregnancy and postpartum. So all of these factors up and down the chain are going to contribute to some symptoms that somebody could be experiencing. And we also want to make sure that we are eliminating any shame and guilt around down there issues. A lot of women are uncomfortable talking about issues that are happening down there, or they just blame it on, it's because I had kids, this or that. But it really should be discussed more because there is so much that we can do to help as pelvic floor physical therapists. So this is our team. Dr. Kaylee Simmerman is the owner and the founder of the Hope Doctors, the CEO. Dr. Andrea Yarborough, she's the director of operations, and she works in Dunedin. Dr. Kate Smith is a clinician in St. Pete. I'm Dr. Katie Allenfeld. I'm within St. Pete and Dunedin as well. Dr. Jaleesa Lowe, she's in Tampa and Riverview area. Dr. Lindsay Leonardos is in St. Pete. And then Brooke Thomas is our client care coordinator and administrative assistant. So we're kind of all over Tampa Bay, depending on where your individual person is, but we also do virtual. So even if they're not directly in the Tampa Bay or they're a little bit outside of where we serve, we can obviously still see them virtually. And we do have mobile options, which is definitely something that is convenient, especially in that early postpartum period. We are able to come to people's houses as well. So what we do, we are pelvic floor physical therapists. We are orthopedically trained. We just have specialized in treating issues that happen around those pelvic floor muscles. So we can treat anything. We'll kind of go through the different things within the next slide of symptoms that pelvic floor physical therapists can treat. But as I mentioned before, as a pelvic floor physical therapist, we're not only looking at the functioning of what those pelvic floor muscles are doing on their own and isolated, but we're looking at everything else. What's happening with the core, what's happening with our rib cage, the spine, the hips, all the way down to the feet, what's going on in the jaw, because all of these can have such a big impact on why somebody is having the symptoms that they're having. And we're always putting our client first with these big evaluations. We are looking at all of these physical things that I just discussed, but we're also talking to them about nutrition, sleep, hormone health, because all of these things do go in and affect their quality of life and also affect the symptoms that they're having. So what we treat, these are kind of broken up into urinary, bowel, sexual, and orthopedic symptoms. But with urinary symptoms, we're often seeing people that are experiencing any kind of leakage, urinary frequency, so feeling that they have to go every 30 minutes or sometimes more frequently than that. If they're having difficulty completely emptying, or they feel like they're waiting a long time before their stream starts, or even some UTI symptoms. If they're getting a lot of symptoms associated with UTIs, like discomfort with urination, abdominal pressure, things like that, and they're going in and their bacteria cultures are coming back negative for that, that sometimes can be due to some pelvic floor issues as well. As far as bowel symptoms go, constipation, hemorrhoids, that's a really big one in postpartum and within that third trimester that we see any kind of fecal leakage or smearing, or they're unable to hold their farts in. And then even sometimes IBS symptoms can be related to some pelvic floor dysfunction. As far as sexual health, pain with sex or orgasm, the inability to orgasm, some hypersensitivity of the vulva, like if wearing underwear or pants or, any kind of tighter clothing around that area is hard to do because it's sensitive. And then we treat men as well. So even things like erectile dysfunction and premature ejaculation, these are things that can be due to some pelvic floor dysfunction. And then we are also orthopedically trained, as I mentioned. So any kind of low back pain, hip pain, pelvic pain, that can come from dysfunction of the pelvic floor muscles, but also we're looking up and down the chain as well. So anything having to do with that kind of pelvic pain or above and below is something that we can address as well. So specifically looking at prenatal and postpartum care for the population that you all are serving. So prenatal care, one of the biggest things that we offer are labor and delivery prep sessions. So within those sessions, we go over perineal stretching massage to help reduce tearing. We go over how to breathe when they're pushing to help decrease pressure on that pelvic floor and help those muscles open up and relax. We go over different positionings that they can be in within the different stages of labor for comfort measures and also to help the baby move down into the pelvis as they go through their labor. We also address some of those more common pain symptoms that somebody might get during their pregnancy. So pubic symphysis pain, round ligament pain, that tailbone or low back pain, sciatic pain. And we also help with exercise modification so that somebody can continue to be active, even though we know that modifications are going to happen as they get later on in their pregnancy. And then as far as postpartum care, any kind of urinary leakage, if they're feeling vulvar or rectal heaviness. So a common complaint is feeling like a tampon is in there, or a tampon is falling out. Pelvic, low back or hip pain that is persistent, pain during intercourse, recovery from a C-section. So really making sure that we're looking at how that scar tissue is moving, helping them early on to make sure that tissue can move well and that we're re-engaging the core. And then we are the ones that are best equipped to evaluate somebody to return safely to exercise. Yes, absolutely. At that 6-week mark, what the OBGYNs and the midwives are doing when they're checking the area there, that's absolutely necessary for a medical clearance, but they're not looking at function of those muscles, not just within the pelvic floor, but in the core too. So that's something that we definitely recommend people coming to us and getting clearance for returning to exercise, just because we're taking a deeper look at all of that as well. So when to refer to us. So, anybody can benefit from pelvic floor physical therapy. So even those trying to conceive during pregnancy and postpartum, we talked about, yes, absolutely. It's amazing if we see somebody within their pregnancy to help them make that connection with the pelvic floor and their core so that that postpartum recovery period goes a little bit more smoothly. But also it would be fantastic to see somebody even before they even get pregnant. That way we can address certain things that we are seeing within the body, not just the pelvic floor, because we know as the body changes throughout pregnancy and postpartum, all of these little asymmetries and issues that we maybe had prior to pregnancy are going to be certainly magnified. So things that we can even start to adjust even prior to pregnancy, the better. If you have somebody that's complaining of pelvic, low back or hip pain, leakage, pain with intercourse, or if you notice, or if they feel like they have some type of diastasis recti, so that abdominal separation, they might see some coning or doming, or they just complain of core weakness, or if they complain of any of the other symptoms that I mentioned before on the previous slides. These are great indicators that they can benefit from pelvic floor physical therapy. So how to contact us? I keep doing that. So we've got, our phone number on here, or email, if you want to send them to our website, that's a great resource as well. And our Instagram is also a great spot for, clients within their pregnancy and postpartum period to be looking at, because we post a lot of great content on there of little tips and tricks and advice. But they can contact us through the Instagram and actually through any of these methods, whatever is easiest. And thank you. Thank you for listening. Please reach out if you have any questions, and we look forward to working with you and your clients.